The truth about coronavirus. With the rapidly growing epidemic and measures increasing in severity, it isn't long until you and your family may be asked to self-isolate to prevent further spread of the virus. In this video, we'll cover the latest evidence of the virus and the best mental and physical measures you can take to keep well during this uncertain time. The facts. Latest research shows how the virus is transmitted easily through air and can make people infectious before ever showing symptoms. Michael Osterholm, an internationally recognised expert in infectious diseases, has estimated over the next 3 to 7 months 96 million cases globally, with around 480,000 deaths occurring. Whilst these are only estimates, they are based on epidemiological evidence and the current doubling rate of infections being 4 days. It is important to recognise that this is not just an old person's disease. This assumption was based on current deaths so far. However, the primary risk factor for death is being old, meaning this group was always at greater risk of mortality. Based on the evidence so far, those under the age of 19 still can be infected with the virus, but don't get sick. This is a pre-existing phenomenon that has previously been seen in hepatitis A, where outbreaks are often detected in daycares as parents and staff get sick, whilst all children test positive without symptoms. Many of the freedoms and pleasures we enjoy and take for granted will be temporarily restricted, and that is likely to cause increased stress and frustration in an already challenging time. This results in panic buying, which is a result of anxiety from survival instincts and a fear of missing out. To do as the herd does feels like the smart option, but in reality we are simply falling foul to our anxieties and fueling fear in others, not to mention restricting the economically disadvantaged and elderly from accessing essential goods. So what can you do to stay safe? The best measures to minimise your risk of getting infected is to avoid crowded public spaces, particularly if you are over the age of 55. The virus is airborne and close proximity to an infected individual enables the sharing of infected air. Wash your hands. Touching the eyes, nose or mouth with unclean hands leads to infection. This is often subconscious and instinctual, so it may help to break this habit and create a reminder and routine, such as wearing disposable blue gloves when leaving the house. Once home, you can dispose of them and wash your hands. It may also help to clean frequently used items such as your phone or keys. Boost your immune system. This sounds too normal to be effective, but without a vaccine at present, it is the best defense. Sleep well, eat well, take vitamins and exercise. Reduce psychological stress. When panicked, we have a tendency to catastrophize situations. A trigger sheet may help you gain control of your worries. How to create one will be linked in the description below. For others, reducing stress may be as simple as having a bath, practicing mindfulness, or reading. Whilst this is an uncertain time for the world, it is important to remember that this will pass with time. Think about others and how your actions might affect them, and let's protect each other together. See you next time.